Now new on Eyewitness News, the outbreak of severe lung disease possibly related to vaping has taken another tragic turn as a third person now has died. The CDC says it's now aware of 450 cases in 33 states of people being sent to the hospital because of possible vaping problems. Here in Connecticut, we are seeing our share of problems too. Channel 3 Eyewitness News reporter Matthew Campbell is live from a vape shop in Old Saybrook with the report that parents need to see. Matthew.
Yeah, Denise, many young people and teens are experimenting with vapes, and the DPH does say that 5 people have been hospitalized right here in our state, possibly because of vaping. But what's so concerning for so many is that people have been doing this for years, and only now are we seeing some go to the hospital.
There's no reason for someone who's never smoked to vape.
That comes from a leading member of Connecticut's vaping community.
Really what we are is we're trying to get people off of cigarettes.
The vaping community says these liquids were made for people like Patrick Leonard. He's trying to kick his nicotine addiction developed years ago.
I was about a pack a day, and now I'm at a very low level of nicotine in the vape.
Across the country and here in Connecticut, we're seeing vaping rise in popularity, unfortunately among many who previously never touched nicotine. It's become an epidemic in schools. Now the spotlight is back on the smoking alternative after the state says 5 people were hospitalized for severe lung disease, possibly related to using these e-cigarettes. Their ages weren't released.
While it's safer than tobacco products as far as products of combustion in the lungs, there apparently still is significant toxicity that we are seeing more and more of.
All of the patients became ill in July or August, and all have been discharged. Right now, the CDC says it's investigating more than 400 cases of severe lung disease across the country. The symptoms range from chest pains to fever, and because vaping is so new, pulmonary doctor Michael Tiger warns there are still a lot of unknowns.
There's a high likelihood of developing an inflammatory reaction, and that's what we're seeing.
But longtime vapers aren't worried by these hospitalizations. They say those patients didn't get their vape cartridges from a store. They likely got it from a drug dealer.
Somebody along the line has cut marijuana cartridges with something called vitamin E oil.
The CDC has labeled them counterfeit cartridges. The liquids contain THC and vitamin E and are popular on the black market.
Unfortunately, it's fine to orally ingest and to use topically, but when inhaled, these are the problems that you're seeing.
And the appeal of getting this THC into some of these cartridges it's order to be able to vape it without attracting too much attention. And now again, a lot of people here in the vape community say this is all for people trying to quit smoking, not for kids trying to chase a fad. In fact, parents are urged to talk to their kids about vaping as early as the 5th grade. That's the latest live here in Old Saybrook. Matthew Campbell, Channel 3 News.